This is the Critical Conversations podcast, a KPOV special project developed to feature unique perspectives and the courage it takes to go there, challenge mundane thought, and question the norm.
The following conversation originally aired on The Point on KPOV 88.9 FM, community radio of the High Desert in Bend, Oregon.
The Supreme Court's Roe v. Wade ruling on January 22nd, 1973 it was, decriminalized abortion nationwide. It gave women the right to access abortion legally all across the country and freed patients to access the health care that they needed when they needed it without fear. You know, and as we know, it's been now overturned, and the challenge for women is just beginning to protect their health care, to protect their reproductive rights. So in the studio this morning is Joanna Dennis-Cook, and she's the manager of the Bend Healthcare Center Planned Parenthood. Welcome to the Friday edition of The Point. This is a very important topic. So, Joanna, tell our listeners a little bit about Bend Health Center and what you offer to the community.
Yeah, so just real quick, I wanted to clarify something that was said at the beginning. So Planned Parenthood Columbia-Willamette, which is what the Bend Health Center is part of, we're actually celebrating 60 years this year. So it's our 60-year anniversary, not 20. So yeah, the Bend Health Center opened in 1998. We offer, full range of reproductive health care. We see roughly 600 visits a month, so we're seeing a lot of folks. Yeah, we just keep showing up every day.
So what kind of demand is there? I mean, you for service, do you do abortion services or?
Yes. Yeah.
You do? Okay.
Yep. We do medication abortions and the in-clinic procedural abortions at the Bend Health Center.
Okay. And what kind of demand is there?
Here's how I'll put it. So since there was a ban that went into effect in Idaho in August of 2022, and since then we've seen an increase of 34% in our abortion services. So we always had a pretty decent demand just serving our local community, and it has increased significantly.
And I understand that abortion is an available service still in Oregon and still through Planned Parenthood, but your primary services are not abortion, correct?
Vast majority of our days are spent doing contraception, doing cervical cancer screenings, doing STI testing, the whole range of things. It is roughly, typically in most years, it's about 5% of what we do. That has gone up a little bit just because we're having to help other states right now.
What are the dangers of having abortion being banned for women?
Well, they're very broad, right? We know anytime that somebody has to travel for essential health care, the costs go up dramatically. The risks of travel go up. We've had folks who've gotten into car accidents coming to see us. Costs include, childcare, transportation costs, missing work. And there's a lot of folks that just can't do that. And so they don't get the services they want or need.
I was wondering, there are states that have, curtailed or outlawed abortion, and they still might have a Planned Parenthood facility in their state. Are services preventing pregnancies, are they available in those Planned Parenthood offices? Yeah,
absolutely. So a good example is there had been clinics in Boise and Meridian. In the Meridian, Planned Parenthood is still open and still serving a lot of folks. They just can't do any abortion services. So there's a lot of coordination when patients show up there wanting abortion services. They coordinate with us to help get them here. But they're still doing a ton of contraception, all those other services they're still providing.
That's the goal, right? Is for people to be very educated and aware of preventative resources, so that they don't have to face the dilemma of choosing one way or the other.
Yeah, people having access to those options and to prevent.
Exactly.
How are you funded?
We take private insurance, so we get a fair amount of insurance payments. Oregon Health Plan we take, and then the state of Oregon has a reproductive health program that helps cover contraceptive services. We have a lot of donor funds, obviously, that contribute. And then, of course, we have cash pay patients. So it's a combination of all those sources.
So if I didn't have any money, if I had no resources, I could come in and be treated?
Absolutely, yeah. Either between the reproductive health program, we have internal funds that can help, like patient assistance funds.
It was a good friend of mine who was instrumental in bringing Planned Parenthood to Central Oregon, and this was in the early 90s, I think. Mm-hmm. And it was very controversial. Are you still facing a lot of those kind of, what would they be, objections, I guess, to having Planned Parenthood in Central Oregon? We
see less, overall. We have a ton of support locally, I will say. But when I came from the health center today to come down here, we had protesters outside our building. And that happens every week. We have protesters. So it's definitely a balance. The support we have locally is more vocal now than it was in the 90s, for sure.
Do you feel safe in the center?
I do. Yeah, we certainly have security measures in place to help, all of our staff and patients feel safe. Yeah.
Good.
One thing that I have a question about is in regards to the abortion ban is receiving abortion pills by mail. Could you talk about if the ban includes that or the rules around that?
So what I can speak to is how we, Planned Parenthood Columbia-Willamette has handled the situation. We do not mail abortion medication. We only mail it within the state of Oregon and Washington, the two states where we have health centers and we have our clinicians licensed in. So if somebody does live out of state, they must physically be in the state of Oregon and Washington to do a telehealth abortion and to get those medications.
I'm from the 60s. You can't tell by my voice.
No. You sound so young, Jackie, dear. Yes.
And this is a very important issue to me because I did grow up when it was illegal. But tell me, what are those abortion? I mean, I sound like the grandma, but really, what are those abortion pills, and how do they work, and are they dangerous, and things like that?
Well, I'll start with they're very, very safe. They're one of the most studied medications. They've been legal in the United States since 2001. It's mifepristone and misoprostol. It's a combination of two medications. There's a variety of ways that the regimen can happen, and it introduces something similar to a miscarriage. And we do it up to 11 weeks of pregnancy. So it can be done during most of the first trimester.
And that's different from the morning after pill.
Yeah, the morning after pill prevents pregnancy before it occurs. So it's going to stop, ovulation and different things to prevent the pregnancy.
Do you provide those pills, morning after pills?
Absolutely, yep.
Okay. So we're going to take a quick break. And when we come back, I want to talk about this virtual luncheon that's happening, because I know a lot of people want to support you. And this seems like a great way to support the mission that you're doing. And I think you're doing it in conjunction with the Planned Parenthood of Willamette. But we'll get into that after a break. We're continuing our very important conversation here with Joanna Dennis-Cook, and she's from the Bend Health Center Planned Parenthood. She's the manager. And we wanted to talk about a virtual event that's coming up this week, which is why we wanted to have her on. But before we get to that, I wanted to just talk about a couple things. First of all, what is what are the rules around abortion here in or pregnancy termination, let's just call it that, around age, parental consent, rape, incest, amount of time? Just fill us in on what it's like here.
Yeah, so we're very fortunate in the state of Oregon. We have very little restrictions. There are, age of consent for medical procedures is 15. So anyone under the age of 15 would need parental consent. We always encourage anyone under the age of 18 to have parents involved, but it's not required. And then as far as, there's no specific limit on up to any specific gestational age or point in pregnancy when you can get a procedure. It obviously gets more difficult as you get further along to find providers that can perform those services.
In the 60s, I worked for a free clinic in Long Beach, and the range of women needing this procedure was astounding to me. From young teenagers, some who could not tell their parents, or their parents would hit them and hurt them, to women who had too many children, and with the cost of living. And so it was a very difficult process to observe someone make the decisions. And yet it was so wonderful when Roe v. Wade was passed. What do you think the future might bring as far as reproductive rights and women? Do you think we're going to continue to go further in our restrictions, or will we have a wake-up call?
Yeah, I mean, I wish I had a crystal ball,
yes,
obviously.
Of course, yeah.
I would say, I'm limited in how much, politically I can talk about, but I do think the, different ballot measures in different states this last November, people overwhelmingly support access to abortion services. And I think that's really promising, and it really, I think gives me a lot of hope that we're going to move into a direction that goes back to more access for more people.
Because we want a healthy nation, right?
Absolutely.
We want healthy women and healthy babies.
Absolutely.
Okay.
Well, to that end, let's talk about, I want to leave time to talk about this virtual event that's coming up. That's on the 25th?
Yeah, next Wednesday, 25th at noon. And people can get more information. It's our annual luncheon. We do it every year. It is partially a fundraiser, partially just awareness raising. And more information is at www.ppcwannualluncheon.org. There's a place to get tickets. Let
me say that a little more slowly.
Oh, so the website. So www.ppcwannualluncheon.org. People can get tickets there. It is pay what you can, so people can pay as little as $0 if they're interested in going.
And I bet
so it's virtual.
It is virtual.
Virtual. And I'm thinking too, Jackie, that people could just Google Planned Parenthood, right?
What CW stands for what?
Columbia Willamette. We are, the Bent Health Center is part of the affiliate that includes Portland, Salem, and Vancouver, Washington, and soon a clinic in Ontario.
Good.
Okay, so what is going to go on if you click on the virtual luncheon? What's going to happen?
There's several speakers presenting. Our keynote speaker is Olivia Juliana, who is a Gen Z activist who raised over $2 million for abortion access after being bullied online by a politician.
Wow.
So she's going to be one of the speakers. Other speakers, or
yeah, I don't. A lot of the other speakers are being kept as a surprise to us right now. So, and it's not a big time commitment. It's usually about an hour, and always very enjoyable.
Do you
Go ahead.
Do you find by having women share their personal stories that you receive more attention and funding?
Yeah, absolutely. Right. That's true for a lot of issues that are controversial. I think anybody who can see the person and their real story, hear what somebody went through, it just humanizes it.
And it makes it real. Yeah, absolutely.
It does. Yeah. I mean, I think many of us, like I said, there was a wonderful movie. I think it was with Cher back in the 60s or 70s, something about behind these closed doors. And it talked about, abortions and women who died. It was really very powerful. I'm sure it's something to revisit.
Absolutely.
So if I get my ham sandwich and I sit at my computer, it's at 12 o'clock.
Yes.
Right? Is that what you said?
Yep.
And so if I go online and it's by donation, I decide what I want to donate, I'll get a link to this virtual summit or virtual luncheon.
That's correct. Yeah. And then you just log in at noon and you get to watch it and enjoy hearing about all the great things we're doing, and of course hearing from amazing speakers.
Wow, that sounds like a lot of fun.
Surprise speakers. I love that. Surprise speakers. We're going to have some surprise speakers.
Yeah.
Are you finding that you're seeing an increase? You said earlier in our conversation about 34%, did you say?
34% increase in need for abortion services.
Now, what does Planned Parenthood think about that? I guess the Texas ruling where they're hoping to fine people who assist an individual in obtaining an abortion, and they could be fined up to $10,000. Mm-hmm. Could that impact Planned Parenthood?
What I'll say is a lot of those, it's tricky to interpret how laws would affect. But the state of Oregon has said that they're going to, they won't participate in those types of lawsuits as far as allowing people here to be sued or to be prosecuted. Planned Parenthood as a whole, right, we're always against any sort of restrictions that make it harder for people to access needed services.
The law in Idaho, which is our neighboring state, began enforcing its trigger ban on August 25th, and that prohibits abortion at all stages of pregnancy, with exceptions for life of the pregnant person or for survivors of rape and incest who have reported the incident to law enforcement. Now, I mean, wow, having a child have to go report that law to somebody, is seems draconian.
Yeah.
It's hard enough to admit it, let alone have to prosecute. So we really appreciate what we're doing, and we appreciate Oregon, the laws in Oregon that are really protecting women, and so they don't have to go through things like that. So in our last minute, we have just a minute left. Again, I'd like you to slowly tell me how people can, two things. I'd like them to know how they can support us here in Oregon, how they can support you, also how they can find out more about that virtual event on Wednesday that I'll be attending.
Yeah, so the website to get tickets for the luncheon is ppcwannualluncheon.org. We, as far as support, obviously donations are always welcome. They do go directly help our patients. And then we're currently recruiting volunteers for here in Bend, and then if people are in other parts of the state. And if you go to ppcw.org, there's a volunteers link, and you can fill out an application to become a volunteer either in the health center or doing patient escort outside when we have protesters.
Yeah.
Oh, yeah. What a great volunteer opportunity.
Yes, absolutely.
Yeah, thanks for sharing that. Well, our time's up. Thank you so much for coming in. We really appreciate this. This is really, Carolyn and I are about really supporting women, and we feel this is an important issue to talk about. Thank you again, and best of luck on the luncheon. If you just tuned in, you were listening to Joanna Dennis-Cook from Bend Health Center Planned Parenthood. Thank you for joining us today on The Point.
Thank you.
You've been listening to a KPOV Critical Conversation. To hear more engaging interviews on important topics, please visit kpov.org/criticalconversations.